everyone. Today we will discuss and learn about blood incompatibilities, what they are, how they happen, their types, symptoms, risk, complications, and how they can be prevented or treated. What is blood incompatibilities? Blood incompatibility happens when a person's immune system reacts negatively to blood cells that carry different antigens or proteins. This can occur during a blood transfusion if the donor and recipient blood types don't match, or during pregnancy when the mother and baby have different blood types. Let Therese discuss further on how blood incompatibilities happens.
How blood incompatibilities happens. Every person has a specific antigens on the red blood cells. When incompatible blood enters the body, the immune system sees it as a foreign. In response, it produces antibodies to destroy those cells. This process called is hemolysis, or the breakdown of the red blood cells. The reaction can range from mild to life-threatening. The two major types of blood incompatibilities. ABO incompatibility. This is the most common and usually mild. It often occurs in newborns when the mother has a blood type O and the baby is A, B, and AB. It can also happen if blood transfusions is done without matching the donor and the recipient's blood groups. Rhesus incompatibility. This involves the Rh factor, a protein found on red blood cells. The most important one is the Rhd antigen. Rh incompatibility happens when a mother is Rh negative, but her baby is Rh positive. This can lead to the rhesus disease of the newborn. Other antigens like Cal and Duffy may also cause reactions, but they are less common.
Let's move on to symptoms of blood incompatibilities. Symptoms depend on whether it happens during transfusion or pregnancy. During a transfusion reaction, fever and chills, chest or back pain, dark urine from hemolysis, shortness of breath, low blood pressure which can lead to shock. During pregnancy or in newborns, hemolytic disease of the newborn, jaundice, yellowing of the skin and eyes, anemia, swelling or edema, enlarged liver or spleen. Several cases may even lead to stillbirth or death after birth.
There is during pregnancy complications having blood incompatibilities. During pregnancy, the biggest risk is hemolytic disease of the newborn. This happens when the mother antibody cross the placenta and attack the baby's red blood cells. It is more likely in Rh incompatibility, meaning Rh negative mothers carrying Rh positive babies. The risk increases with each pregnancy if it is not treated properly.
Communication in both mother and newborn. For the mother, communication can include severe anemia, shock, kidney failure due to hemoglobin breakdown, and in case even death, and if left untreated. For the newborn, communication include one dies with a lead in the Cameron's type of brain damage, anemia, organ failure, and extreme case death.
Blood incompatibilities can be prevented by carefully checking and matching blood types before transfusions and screening for minor blood group antigens when needed. During pregnancy, Rh negative mothers are given an Rh immunoglobulin shot at 28 weeks and within 72 hours after birth. If the baby is Rh positive, the mother's blood is regularly tested for antibodies, and the baby's blood may be checked for bilirubin and hemoglobin levels. In severe cases, the baby may need a blood transfusions before or after birth.
In summary, blood incompatibility occurs when mismatched blood types cause the immune system to attack the red blood cells.
It can happen in blood transfusions and during pregnancy, leading to serious risks for both mother and child.
But with proper screening, monitoring, and treatment, especially with Rh hemoglobin. Many of these complications can be prevented. Thank you for listening.